So the next step is to mark up the face before we do the Endolift procedure. There's a very important step that we have to pay attention to because there are some key parts of the face that we have to avoid when we're doing the Endolift procedure. So when we're marking the face, you want to feel the lower arch of this cheekbone here, or zygomatic arch, because up here you really get nothing between the skin and the bone, so we don't really want to apply any energy to this level. So it's really from here down that we apply the Endolift device. So if I draw it down here like this, now you can see with our lovely patient here, we've got a little bit of heaviness in these nasolabial fat pads. Now the Endolift device allows us to do a little bit of debulking in the face where we need to. We've got areas of little bits of stubborn excess fat. We can actually debulk those slightly and create some nice tightening effect in the face at the same time. And so this is here is an area which you probably want to do ever so slight debulking. Okay. The other parts are just here, sort of in these buccal areas that you see here. We're carrying a little bit of excess. These are areas that we also want to debulk, and we're able to do that with the Endolift. So if I quickly draw this side of the face, the next border is marionette lines, okay? And so this area here is the place where we want to do a bit of tightening and debulking. So I'm just going to clearly mark this area out, okay? This part of the face down here, so along the side of the jawline, you have a nerve called your marginal mandibular nerve, and it runs deep underneath the platysma muscle. The platysma muscle covers all of this neck, and when someone stretches their neck out, these little lines that you see here is basically platysma muscle. And we can often use Botox here to relax those muscles. But it spreads up and it inserts just above the jawline here into the bone. And underneath that muscle, the marginal mandibular line is just under the jawline, and it pops up superficially just around about here, which makes it exposed. And so this is an area that we definitely do not want to reach with the Endolift device, because any heat from the fiber that comes this close to the nerve might impact the nerve. This is the no-go zone, okay? And we draw it all the way down under here, because where this nerve is actually exposed the most is right at the bone here. So this area in particular is where we don't want to go with the Endolift device. Now, this time, if you can tilt your chin down for me. Okay, so what we want to look at here is any submental laxity that we've got. And you can see that we just want to tighten all of this up under here. You can see a little bit of submental laxity going on here. So what we're going to do is we're going to come down with the fiber. We're going to try and create a bit of tightening and lift. Okay, let me tilt your head back up for me. So